This recording talks about fluid and electrolyte problems in trauma patients. Not every trauma patient will have every fluid and electrolyte problem that we're going to be discussing, but each person to some extent does. Potassium is lost from cells due to catabolism or cellular breakdown. Remember, when you have trauma, you have a lot of tissue damage. As potassium leaves, sodium and chloride with water shift into the cells. The sodium pump does not function properly. If you don't remember how the sodium pump works and what it's used for, please make sure that you go back to your anatomy and physiology material and take another look at that. Fluids along with sodium shift into the cells into the third space, or either the interstitial spaces, at the injured site. The increased cellular and third space fluids cause a vascular fluid deficit, which is also known as dehydration, and hyponatremia. Serum osmolality may be normal or increased due to the fluid deficit and excess solutes other than sodium, such as potassium and urea. Remember, sodium influences the osmolality of plasma. The volume and composition of extracellular fluid fluctuates depending on the number of cells injured and the body's ability to restore balance. 2 to 3 days following injury, fluid shifts from the third space at the injured site back into the vascular space. Trauma results in nitrogen loss due to increased protein catabolism, decreased protein anabolism, and or a protein shift with water into the interstitial space. The colloid osmotic pressure is decreased in the vascular fluid and increased in interstitial fluid, the tissues essentially, which causes fluid volume deficit in the vascular spaces and edema. Increased capillary permeability causes water to flow into and out of the cells and into tissue spaces. This contributes to hypovolemia or fluid volume deficit. ADH and aldosterone, help to restore the extracellular fluid. A vascular fluid deficit and or increased serum osmolality stimulates antidiuretic hormone secretion, which causes water reabsorption from the distal tubules of the kidneys. In certain traumatic situations with surgery, trauma, or pain, SIADH occurs and causes excess water reabsorption from the kidneys. Aldosterone is secreted from the adrenal cortex due to hyponatremia and stress. Aldosterone promotes sodium reabsorption from the renal tubules and is reabsorbed with water. Potassium is excreted. Make sure you go back and you review SIADH and diabetes insipidus from your 210 lectures, because when we get into the neuro portion, the head injury portion of the class, diabetes insipidus and SIADH are possibilities that can happen with those types of injuries, so make sure you review that. Kidney activity is altered during and after a severe traumatic injury. Sodium chloride and water shift to the injured site, which causes hypovolemia. Decreased circulatory flow can decrease renal artery flow, which can cause temporary or permanent kidney damage. Impaired kidney function results in hyperkalemia. Also go back and review from 210 the causes of acute renal failure. You have pre-renal, intrarenal, and post-renal causes. Decreased circulatory flow can decrease renal artery flow, which causes temporary or permanent kidney damage. Make sure you understand what type of acute renal failure is that. With cellular breakdown and hypoxia from decreased perfusion, non-volatile acids such as lactic acid increase in the vascular fluid, causing metabolic acidosis. Kidneys conserve or excrete the hydrogen ion to maintain the acid-base balance. Decreased kidney function can cause hydrogen retention and acidosis. The lungs try to compensate for the acidotic state by blowing off excess CO2, otherwise you hyperventilate. Blowing off CO2 decreases the formation of carbonic acid. This ends the PowerPoint of just some basic fluid and electrolyte problems in the trauma patient. Don't try to nitpick these things and pull it apart piece by piece. Get a general understanding of what can happen. Go back and review parts and pieces of the fluid and electrolytes that you don't remember or don't fully understand. And we'll continue on with trauma lectures at a later